Welcome to today's episode of IVF Unplugged, the honest voice for aspiring parents. The process of IVF or in vitro fertilization helps couples have biological children of their own. But one must bear in mind that only about 50% of couples who undergo the process are successful in the first attempt. A failed IVF cycle can be one of the most heartbreaking experiences on the path to parenthood. The emotional and physical toll is immense, and it's natural to feel lost or unsure of what to do next. Today we have with us Dr. Swapna. She is Clinical Director and IVF Specialist from Nova Fertility Center, Vijayawada, who will discuss how to heal, when to start thinking about another attempt, and what medical adjustments might give you a better chance of success the next time around. Let's begin. Dr. Swapna, welcome on board.
Hi, Karunya. Thanks for having me.
So, to start today's conversation, the first thing I want to ask you is, can IVF guarantee pregnancy in the very first attempt?
Right. Though IVF is known to be one of the best treatments for infertile couple with the highest success rate, still we cannot guarantee success in the first attempt itself. It does not mean that they cannot have any further treatments. So some couple conceive in the first attempt, whereas majority of them do conceive with later attempts. So to summarize, just because someone does not conceive in the first attempt, they don't need to lose hope. There are various options, and if they continue their treatments, majority of the couples do get good results. And I do emphasize that the success of first IVF attempt is mainly based on the age of the female as well as the male, and also on the ovarian reserve of the women, which means the number of eggs that they are left with at that particular age. And we measure that with a couple of hormone tests, which is one of the main tests is anti-Mullerian hormone, and also checking the antral follicles, how many antral follicles are there in each ovary on scan, ultrasound scan. And not just that, this is only the female part, but also recently there's been more scientific evidence saying that to a certain extent, male age also has some effect on the success rate of IVF pregnancies. However, female age still is more crucial, not just in terms of eggs, but also in terms of carrying a pregnancy at different ages and having a healthy live baby. So IVF is helpful for majority of them, but not always in the first attempt.
Okay, got it. But let's say after a failed IVF cycle, what is the very first thing an aspiring parent should do?
First of all, they need to understand, even before starting the treatment, that it's not always successful in the first attempt. As soon as they get the result, they will be shocked and disappointed. They should not take any immediate decisions during that time. So the clinician, whoever is addressing or seeing this couple, they need to give the time to the couple to sink in, and the couple need to go back once they have this result synced in, and once they go back and speak to the clinician or the consultant, whoever is seeing them, to understand what the causes might be. And there are multiple causes, but what could be the main reason in their case, and what else can be done further to enhance the success rates of pregnancy is what they need to go and discuss. They don't need to rush, but they need some time for themselves to be physically and mentally able to take balanced decisions. So the clinician also need to get the information from the couple, how they're feeling, what is their perception of what they went through, and what is their expectation of what they want, and what is the realistic situation is what we need to discuss. And we need to have a combined discussion how to go about further. So though initially they're very disappointed, we need to give them that time, but ensure that they understand to come back to discuss what could be the causes and then move further, because the most important thing to have a successful pregnancy is not to leave it just after the first attempt. As we try harder, the success rates are increasing. Very exceptionally, we don't advise not to try, but that's really exceptional. Majority of the couples understanding what went wrong and improving on that definitely will help majority of the couples achieve their dream of parenthood.
From a medical perspective, is there a way to know what went wrong in the IVF, in a failed IVF cycle, and how important is it to do that?
Yes, definitely. So in IVF process, there are various steps. So initially, we need to optimize both wife as well as the husband. Sometimes the semen analysis parameters may need to improve a little bit, so we try our best to improve that, and also the female in terms of their general health and obesity and all these lifestyle factors we optimize before starting. But not always everybody can achieve whatever is the ideal one. So apart from that, when we start the stimulation, what was their response to the medications we used in that cycle? How many oocytes have been retrieved? What is the quality of those oocytes? And on the day of the ICSI or IVF, how were the sperm? And what was the fertilization rate? That means after injecting X number of eggs, how many of them resulted in embryos, which is the fertilization rate. And on checking on day 3, how many progressed. And up to day 5, we do culture in the current scenario, and maximum up to the morning of day 6. But till further is only seen in research, but for all practical purposes, we go for day 5 embryos. So there might be at any of these steps, they may not be optimal, or all of them may be optimal. And we need to also look at the quality of the embryos, not just morphologically, but also now we have advances like pre-implantation genetic testing for aneuploidies, because all day 5 embryos are not necessarily genetically normal, which we call it as a euploid embryo. So when we further test these embryos by taking out some cells from day 5 embryos and sending them for genetic testing, while these embryos are frozen, we understand how good these embryos are in terms of genetic aspect. So there could be issue at that point as well. And not just that, embryo is only one part of it. Endometrium, which is the inner layer of the uterus or the womb, that needs to be optimal as well. Though sometimes all of these might be okay, still they may not result in a pregnancy. There are other factors which could be hormones, which could be immunological factors, and some factors which we cannot test. And there are further endometrial testing, like endometrial receptivity array tests. These in only certain group of patients we can use. So we explain all this to the couple, but majority of the time it could be either the embryo abnormalities or the endometrium. But in younger age group patients, without further testing, we can go ahead with further transfers after discussion with the couple. But in advanced age group, there may be a role for some tests, whichever are appropriate for that particular couple, before proceeding for further treatment to enhance the success rates.
Okay. But can you also talk to us about what are some of the most effective strategies that you recommend for coping with grief, with disappointment of a failed cycle?
I know it can be very, very challenging for the couple, and I've seen a lot of couples. Some of them may have tried very short period of time, but someone who has tried multiple cycles is extremely difficult. So the best effective coping strategies, there's not a single one for all of them. Everybody is different. So everybody has different ways of coping strategies. So we need to understand what works well for that couple from as a clinician, as well as the couple also need to identify how they can navigate through that process. That comes out when we have a discussion with the clinician, psychological counselor, family, as well as the couple. So family plays a very important role when it comes to supporting a couple and coming over this grief. What I do encourage the couple is trying to understand that this is not the end of the tunnel. There is still light at the end of the tunnel. So I give examples of couple who went through even worse situations, but still they achieved a live baby and how happy they are. And if needed, we encourage the couple to speak to them to get the hope that they can still achieve their dream of parenthood. So discussing with other couple in the same journey also gives them a lot of strength and hope. I have a lot of patients. I can tell you an example. One of my patients, I was traveling and they knew that I was traveling and they wanted to come and meet me, show their babies. But that was their second cycle and they had twin, a girl and a boy. But when they came and showed me, they were so emotional. What they told me was initially when the cycle failed, they both were so depressed that they wanted to end themselves. That severe it was. But what they told was we called them, we followed them up, how they were feeling with the regular interactions from me and the junior doctors as well as the psychological counselor. But the most important thing was one of my other patient, they also contacted them and they said, please do not lose hope. Please have hope. Go back and speak to them and see what they say, what they encourage them. And they said because of all that, they've come back to me and they had another cycle and they had this lovely girl and a boy. So there's multiple factors which work for each of them. So we need to identify, and talking to people who went through the journey and who ended, I think is the most effective coping strategy for any couple, what I found for majority of them. And family support.
What about when they're starting to think about a new cycle? When is the right time to start thinking for, attempting a new cycle, and how much time does the body need to recover?
So again, coming to that, some patients have frozen embryos from the previous cycle. Some patients don't have frozen embryos from the previous cycle. So someone who has frozen embryos from the previous cycle, they can just take a month's break and see how they feel. If they feel that physically and mentally they are prepared to face it, then they can go after a month's break. There is no hard and fast rule, but it depends on their general well-being. I do give a month's break because I want them to come off the drugs and have some healthy lifestyle and regain their energy back and motivation and come back to the positive sense before they start the cycle. So if they have to go for another IVF cycle, it depends on how what is the cause of their infertility. If it's a poor ovarian reserve, I think they can start immediately or after a 1 month's gap, because again the eggs decrease with the age. There is no point in waiting too long. So in order to gain the most, we have to ensure that we don't delay these cycles, IVF cycles. So because there is evidence saying that the higher number of eggs we get, up to 15 oocytes or eggs, the higher the success rate. So each extra egg increases the success rate. So we don't want to delay in someone who has less number of eggs or advanced age because genetic abnormalities increase. But someone who's of a younger age who wants to take a little more time, it depends on how prepared they are and how they feel about the whole process. So it's again, there is no hard and fast rule. It depends on the couple and their cause of infertility and how much time they need to be able to physically and mentally face the next cycle.
Got it. So, in the long run, do you think better quality medicines actually reduce your total treatment cost by shortening the time to pregnancy? Do you think that?
Definitely, I completely believe in that, and that's what I do. And so, the quality of the medications is extremely important, and we do need the medications which have been having a good, good studies, that proven studies that they're safe to use and effective in terms of response to stimulation and getting good quality eggs, which again will result in good quality embryos. The higher the number of embryos, we can choose the best amongst them. That can result in successful pregnancy the first time itself. And if we do have frozen embryos, they can again go for a second child as well if it's successful in the first attempt, because these frozen embryos are good enough even after a few years. And if they are not successful in the first attempt, having more embryos will again prevent them from having a whole IVF cycle, and they will have minimal medication. If we are using good quality medications, definitely the chances of pregnancy are slightly higher, the side effects are less, and there is less pill burden on the patients, which obviously they don't feel that stressful, because what I hear from majority of the patients is they are under the assumption that IVF means a lot of medications and injections, but whereas we can do with the minimal possible medications, but when we use quality medications. So we need to use the right medications and the right quality, then the couple will not feel stressful even when they go through IVF.
All right. Dr. Swapna, thank you so much for joining us today on IVF Unplugged, the honest voice for aspiring parents, powered by Merck. It was great getting in your insights and your inputs on the show.
Thank you very much for having me, Karunya, and it's a pleasure to be able to speak, and I wish all the best for all the couples who are aspiring to become parents, and we truly pray for all of them. Thank you.
And we hope that everyone watching us and watching this conversation, they've got clarity, comfort, and confidence as they take more steps towards their journey to parenthood. Remember that every story is unique and you are not alone. Until next time, take care.